This is called a port wine stain birthmark. It is not a hemangioma, and it does not have the same risk as a birthmark like that, which it is often mistaken for. I think hemangiomas are often referred to as like a strawberry type birthmark. They're both vascular related, which I think that's why they sort of get mixed up. Now with mine, I could have surgery on it, but I would never get full clearance of the port wine stain birthmark because it is, again, vascular, meaning it is blood flow involved. Therefore, the color would always return and I would have to always get it done my entire life. I do need treatment on it right now because I have this little bleb that popped up and this little spot, like these little spots are going to start popping up as I get older. It's more so to maintain the health of the skin more than it is anything else. The next question I'm going to go ahead and answer is, why don't I use green color correction? Well, while I know to the surface it does give so much red presentation, I noticed that when I put green color corrector under, it just made everything gray, maybe even green. Like it just didn't blend well and it just didn't work for my situation. Instead of underpainting when I want to fully cover it, but I don't want to use full coverage foundation because realistically at the end of the day, using full coverage is so cakey and it's not realistic for everyday wear because I feel like it doesn't let my skin breathe. But what I'll do is I'll take yellow and I will put on normal foundation. Sometimes I wear the same color across my entire face and then I will overpaint with yellow foundation, and that seems to blend so much better because once you put the foundation on, now you're just combating the tone that comes through the foundation. The other thing is, does it hurt? No, it doesn't cause me any pain at all. And it is further than just surface level. I have it here and then my gums are two different colors. Sorry, I don't know how y'all feel about that. And my eye is affected. I know a lot of people's port wine stains or their birthmarks don't really affect their eye, but mine does. So that's why this eye is like really red. I actually have a shunt in my eye. That's that little yellow patch there that I got as a baby because they feared that I had like glaucoma. Do keep in mind, I do know that laser surgery is an option and that full coverage, like true full coverage foundation is an option. I want to make sure that there are options that people can use that will give them the best bang for buck, but also allows their skin to breathe, if that makes sense. Because if you have worn full coverage foundation, often you know that A, it can be really cakey, and B, it just doesn't feel good on the skin for very long. But anyway, if you have any other comments or suggestions, feel free to leave them down below in a respectful manner. I will let you know.